first rib in extension. So we're going to have a little bit of rotation. First MCP contact. Reposition my body, oblique thrust towards the axilla. Side contact, and we're going to take up the slack. Remember, we are in extension in this position, but we're not compromising the upper cervical. Let's take a deep breath. And as she breathes out, follow through.
Oh. Have to do is just drop, okay? Instead of me doing, normally I would do this thigh sandwich. I've got you drop down between and this way. I'm literally having to lock you here and push you here. Whereas if I show you, if I set you up again, so I'm pushing a little bit in from my hip into her needle locker. I'm coming up, I've got my knee in her knee. I've come here, my thigh's against her thigh. Breathe in. As you breathe out, push your tummy out towards me. There we go. Okay? So the